This case is representative of a very common scenario faced by clinicians in the outpatient setting. CDC indicates that the third most frequent diagnosis during office visits is the common cold, something that's not surprising since most adults experience 2 to 4 colds each year. Throughout this case, the clinician illustrated strategies included in the Get Smart mnemonic, including directly eliciting the patient's expectations for an antibiotic prescription, sharing normal physical exam findings with the patient in real time, and, in this instance, providing a delayed antibiotic prescription as part of a contingency plan. The case also allows us to briefly review the epidemiology and recommended management strategy for acute rhinosinusitis. According to a recent narrative review, viruses cause most cases of infectious sinusitis, and in fact, bacteria cause fewer than 2% of cases. This same review pointed out that the duration of sinusitis symptoms range from several days to more than a month, something that is often frustrating to patients and to clinicians alike. Current guidelines recommend reserving antibiotic therapy for a limited group of patients. Those with severe symptoms or fever greater than 39 degrees centigrade and purulent nasal discharge, or so-called double sickening, that is, a worsening of symptoms following 5 days of typical viral upper respiratory tract infection, or those with symptoms that persist without improvement for greater than 10 days. If antibiotic therapy is indicated in a patient with rhinosinusitis, amoxicillin clavulanate is the preferred choice for non-allergic patients without risk factors for infection due to multi-drug resistant organisms. Fluoroquinolones should be reserved for patients with penicillin allergies or who have failed first-line therapy. Trimethoprim sulfamethoxazole and macrolides, such as azithromycin, are not recommended due to frequent resistance in Streptococcus pneumoniae. Finally, if antibiotic administration is indicated, current guidelines recommend only 5 to 7 days of therapy instead of the more traditionally used 10 to 14 days.